Assalamualaikum warahmatullahi wabarakatuh. Hi everyone. We are going to continue with module 4, and in this module 4 we are going to learn about the prevention of CRBSI, focusing on the insertion bundle. If I may recap, in the module 3 you were given all the information on the general recommendations for the catheter care. And in this module 4, this is actually specific prevention of CRBSI, focusing on the insertion bundle. Before we go further, let me just explain to you what is actually bundle means. Yeah, if you notice, we use a lot of words bundle. So this is not the bundle that we, the clothes bundle from Japan, bundle from US. This is actually the medical terms of bundle. Before we go further, just let me explain to you what is actually bundle. Right? You see, the concept of bundle is actually a structured method of improving the process of care and patient outcome. So this is actually few good practices that people combine together to improve the process of patient care, and at the end it gives a good outcomes of the patient in the hospital. So it is actually incorporate evidence-based science into practices. Yeah. So when we talk about bundle, it is actually something that has the scientific value behind that. All this will result in better outcome. Then, if we compare, then when we implemented it individually. Okay, hope it clears. Alright. Before we go to the components of the bundle, just let me share with you. There are general rules for the central venous catheter insertion to make sure we are not promoting infection. Number one, the procedure should be performed in the treatment room, or in the specific area, not something that we can do in the open ward anywhere. Second, fan should be switched off to prevent contamination from the environment. And number three, we have to make sure the waste management system is in place. We have to make sure that the sharp bins, the general waste bin, and also the clinical waste bin is within the reach of the operator. So these are the general rules for the central venous catheter insertion. So next is actually, this slide shows you the components of the insertion bundle. There are 5 components of insertion bundle. Number one, hand hygiene. So if you remember, hand hygiene is everywhere. Number 2, maximal barrier precaution upon insertion for the operator and also for the patients. Number 3 is the use of the proper skin antisepsis. So for central venous catheter insertion, we advise of usage of 2% chlorhexidine in 17% alcohol as a skin antisepsis. Number 4, optimal site selection. Most of the time we will advise not to insert the femoral catheter, because it is associated with very high infection rate. And finally, number 5, daily review of the catheter needs. So hand hygiene. When caring for central venous catheter, hand hygiene should be performed 1, before and after palpating the catheter insertion sites. Number 2, before donning gloves or gowns. And number 3, before and after inserting, replacing, assessing, or dressing the catheter. Number 4, after removing the glove. This is the one that people always forget. After removing the glove, we should do the hand hygiene also. For generally, in module 6, I think, module 6, we have a proper hand hygiene module where everything can be learned from that module. Second component of the insertion bundle is the maximal barrier precaution upon insertion. So I mentioned just now, maximal barrier meant for both operators and patients. So before and after inserting, replacing, assessing or dressing the catheter, the operator should wear one cap, mask, surgical mask, sterile glove and also long sleeve sterile gown. Yeah, the assistant who helps to drop the item into the field, onto the sterile field, will have to wear the cap and also mask. Yeah, and all the set should be sterile sets lah, right? We should not allow the operator to wear suboptimal barrier precautions. Yeah, for example, this doctors is just wearing the plastic apron with the glove without caps and also without proper sterile gown. This is something that is totally wrong. Yeah. As for the patients should be covered all from head to toe, except or only exposing the area for insertion site. Yeah, and so these are the examples of the photo of the patient who undergo central venous catheter insertion. Now we go to the component number 3 of the catheter insertion. The use of chlorhexidine as skin antisepsis. Yeah, for central venous catheter insertion, the skin should be disinfected with 2% chlorhexidine in 70% alcohol before insertion of the catheter and also during the dressing, yeah, of the catheter, right? So in Malaysia, we use a certain name. We have the commercially available mixture of the 2% chlorhexidine in 70% alcohol, and normally we use that for our skin disinfectant. As a reminder, we should know that we should only use the new unopened bottle each time. So we should not share one bottle of the skin disinfectant with another patient. So it is advisable that scrubbing back and forth motions for 30 seconds is a good practice to reduce the bacterial burden prior to the puncture of the skin. The antiseptic solution must be allowed to dry completely before puncturing the site. Yeah, that is a very important point. Yeah, the skin should be dry before you puncture for insertion of the catheter. Point number 4, component number 4 is the optimal catheter site selection, where subclavian approach is preferred to the jugular and femoral approach whenever possible. Yeah, so always go with the subclavian whenever possible, and when there is no contraindication and based on operator skills. Yeah, but then we have to take note that in patients with renal failure, subclavian should be avoided to minimize the stenosis, which may limit future vascular access options. And number 5, the last component of the central venous catheter insertion bundle is the daily review of the line necessity or daily review of the catheter needs. Yeah? So central venous catheter should be reviewed every day, whether it is still needed or not. Once it is no more needed, once there is no more indication, it should be removed immediately. We should update daily until the catheter is removed. So this is the example of the forms that we normally use in the management of the central venous catheter care bundle. We call it central venous catheter bundle compliance audit form. So for example, in this form, we have at the bottom here the daily review of the catheter needs. Yeah, number 4, daily review of CVC. Yeah, whether it is indicated or not. Once it is not indicated, then we have to remove it immediately. This will prevent the daily review of the catheter needs, will prevent unnecessary delays in the removing lines, removing central line that are not clearly needed. Many times we notice that central lines remain in place because the healthcare providers or healthcare personnel do not consider removing them once it is not indicated. Yeah, with that, this is another form that we use for daily review of the catheter needs. Yeah, we have all the indication here, and the operator or the person who do the review should sign below. So with that, I thank you. See you in the next module. Assalamualaikum warahmatullahi wabarakatuh.